We are celebrating CDI Week, which stands for Clinical Documentation Improvement. I would like to explain the role that CDI plays in your life as a healthcare professional. In today's world of healthcare, quality of care and adequate reimbursement are feverishly being pursued. We live in a world of measurement and increasing accountability. These measurements are obtained by screening physician notes and are resulting in public profiles that are easy for everyone to obtain. CDI professionals can assist providers achieve better profiles and maximize legitimate reimbursements. Precise and more specific documentation will help capture the true severity of a patient's illness and avoid a provider from being mislabeled as an overutilizer of hospital resources and hospital days. Effective use of the CDI program can result in better quality rates when we look at the interpretation of quality in the public profiles. Insurances use these public profiles to partner with high quality and cost-efficient facilities and doctors. Also, smart consumers are also using these public profiles to choose their facility and their providers.
Clinical documentation improvement specialists are usually certified coders, registered nurses, certified clinical documentation specialists, or other healthcare professionals with strong clinical skills and knowledge of coding, compliance, and healthcare regulations. They help bridge the gap between coding professionals and the clinical staff. Their job is to make the patient look as sick on paper as she or he is in real life. Collaboration is one of our main eye care values we abide by on a daily basis. We collaborate with clinicians and various departments in the hospital, including quality, case management, nursing, health information management, and the finance department. We also work with ancillary departments in IT to implement new designs to assist clinicians with documentation. A query is a question we ask clinicians to verify the validity of the information that is documented in the medical record. Queries are done verbally or written to clarify legibility, completeness, clarity, consistency, and precision of documentation in the medical record. On a daily basis, the clinical documentation specialists review the entire patient medical record to assess whether all conditions and treatments are documented.
I wanted to give a few examples of queries. My first example will be for congestive heart failure, or CHF. In reviewing a medical record, I noted that the clinician had documented a diagnosis of congestive heart failure. I also noted the patient has cardiomyopathy, a low ejection fraction at 20%, and has all the classic signs and symptoms of CHF. This patient was treated with IV Lasix. As a CDI specialist, my job would be to put a query on the chart seeking further clarity of the severity or acuity of CHF, which would be acute, chronic, acute on chronic, as well as the type, whether it be systolic, diastolic, or a combination of both. In this example, I would be looking for the clinician to document acute systolic CHF. My next example of a query would be for anemia. If I'm reviewing the chart and note that the physician has documented symptomatic anemia, I further read the chart and note that the patient has dizziness, they're bleeding, and they have a low hemoglobin. They are also treated with a blood transfusion. As a clinical documentation specialist, I will look for further specificity of the anemia. As seen on the query sheet, there are a variety of choices for the clinician to select. In this instance, I would be looking for the clinician to document acute blood loss anemia. Another example of a query would be for chest pain. If the clinician documents the diagnosis of chest pain, as a clinical documentation specialist, we would query for the type or the cause. There are a variety of types and causes of chest pain, which could range anywhere from a cardiac issue to a GI issue to musculoskeletal, or it could be an atypical chest pain, just to name a few. By ensuring that each diagnosis in the chart is as specific as possible, our goal as a department is to increase the risk of mortality, increase the severity of illness, decrease overall hospital length of stay, improve clinician and hospital profiles, as well as obtain accurate and appropriate claim reimbursement.
Clinical documentation specialists could not accomplish all this on their own. Without the support of the medical staff and administration, this program would not be a success. Another major attribute is Dr. Ciccarelli, our physician advisor. She promotes and supports clinical documentation specialists, and she provides ongoing education to physicians, clinicians, and the CDI department. Moving forward, our department will work with the hospital staff to implement ICD-10. ICD-10 will be the new coding system the coders will use effective October 1st, 2014. Additional information can be found on the team website.